Hi, everyone. Thank you for joining us today for our webinar. We're going to give you guys a few more minutes to allow everyone to join our webinar before we begin. Thank you for everybody that's joining us for today's webinar. We're going to give you guys about 30 more seconds before we begin. Okay. Hi, everybody. My name is Nadine, and here at School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Introducing the School Oral Health Resource Library, a tool to strengthen and connect the oral health community to resources. During today's presentation, we'll explore the School Oral Health Resource Library. We'll learn about current resources, including resources from 2 national contributors, and discuss how you can enter your resources. But before we begin, we have a few housekeeping reminders. First, please help us with our attendance count. If you are viewing as a group, please go to the chat window in the chat icon and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use your Zoom toolbar. Use the Q&A icon located in your Zoom toolbar. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit School-Based Health Alliance for additional archived webinars for topics such as the ones you are viewing on your screen. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. When health and education come together, great things happen. attendance improves, conditions like asthma or diabetes are better managed, behavioral health issues get quick expert attention, and we all know that healthy students make better learners. Now I'd like to introduce our presenters today. Karen Carlson has more than 30 years experience in nonprofit healthcare management and 14 years of experience in oral health leadership. She was the president/CEO of Dental Aid, a Colorado nonprofit dental provider for almost 10 years. Karen was the co-chair of the board of directors of Oral Health Awareness Colorado before she became the executive director of its successor organization, Oral Health Colorado. Karen served on the board of the American Network of Oral Health Coalitions. She co-hosted the first West/Midwest regional meeting for DentaQuest grantees and has participated in national oral health meetings throughout the past 15 years. Karen currently contracts with Oral Health Colorado as the Smart Mouths, Smart Kids implementation consultant. Katrina Holt is the director of the National Maternal and Child Oral Health Resource Center located at Georgetown University in Washington, D.C. In this capacity, she works closely with the Maternal and Child Health Bureau and other federal agencies, national associations, and other organizations and experts to improve the oral health of pregnant women, children, adolescents, and their families. To accomplish this, the Resource Center gathers, develops, and shares information and materials to promote oral health services for the maternal and child health population. Nataki Duncan is the program associate here at School-Based Health Alliance. She supports the School Oral Health Initiative in engaging school districts across the country to expand oral health services and disseminating school oral health resources to field. In addition, she also provides programmatic support to the project and its virtual learning collaborative. Thank you, everyone. I will now turn it over to our presenters.
Hi, thank you all for joining us today. My name is Nataki Duncan, and I'm the Program Associate of the School Oral Health Initiative at the Alliance. And with the support of the DentaQuest Foundation, this initiative took on the Oral Health 2020 target goal of incorporating oral health into the education system. The Alliance formed a virtual learning collaborative with 7 of the largest U.S. school districts and an additional 7 school districts from Arkansas for all those who are from there, North Carolina, and South Carolina, all of whom are using improved consent rates as a marker for access to care. Along with the virtual learning collaborative, we partner with national oral health experts to define the core components of school oral health, identify standardized measures of outcomes, and disseminate resources and tools to support school oral health. One mode of dissemination is through the School Oral Health Resource Library. Today, we'll explore the goal of the resource library, how you and your team can use it, what types of resources are included, and then we will end with how you can contribute. You'll hear more from 2 of our national contributors whose resources are also in the resource library, so don't touch that dial. So, why was this tool created? With the help of our partners from ASTDD, Children's Dental Health Project, the National Maternal and Child Oral Health Resource Center, and Oral Health America, we designed this library as a platform to elevate resources from the national, state, and local levels, and directly connect visitors to oral health resources for school-aged children and adolescents from reputable organizations. So who is this tool for? The resource library is designed for any and everyone who is engaged in school health. On your screen, you will see a few examples of the folks who are interested in or are currently involved in school oral health efforts that aren't your run-of-the-mill dentist, dental hygienist, or school-based Sealant program staff. In this library, you'll find resources for everyone who is anyone engaged in oral health programs or school health activities. So the resources in the resource library are organized around components that are included in a comprehensive school oral health program. Those components are oral health education, screening and risk assessment, preventive care, care coordination, cleaning and exams and treatment, integrated services, data and program evaluation, and sustainability. Each of these little squares you see on your screen will take you to resources on that particular topic. For example, by clicking on preventive care, you'll be directed to resources all on preventive care. With this structure, visitors can search resources they need for all areas of their programs and or specific activities. But wait, there's more. Visitors of the School Oral Health Resource Library can further filter the resources they're looking for using this handy filtering tool we've created. As you can see, the options are many. Users can search by category, which are components, audience type, and resource type. We've added this filtering tool to be a direct route to what you need and to cut out the things you may not need right now. Now that we've gone over the structure of the library, let's take a look at the resource entries themselves. The resource entry gives you all the information you need in one place, right in that same window. Each resource entry includes a resource title, a link to the downloadable resource, which can be a PDF, doc, Excel, you name it, or a direct web link. It also includes the publishing year of the resource and the source's contact information, which you see below, which expands to include a contact person and their email address if available, and the direct link to the resource's homepage. At this point, you're probably wondering, how are they collecting these resources? And if you're not, maybe you should check your polls. These resources come from varying reputable organizations and databases, including resources well-known at the state and or local level. One example of a well-known resource in the resource library is the Smart Kids Smart Mouth Toolkit based in Colorado. This toolkit is designed to encourage communities across the state and country to establish sustainable preventive oral health programs. Today, we have Karen Carlson from Smart Mouth, Smart Kids, who will say more about this toolkit. And also joining her is Grace Lynn, her partner in creating this toolkit. So we'll just take a few minutes just to hand them over our control.
Hi, I'm Karen Carlson, and as Nataki said, Grace Lynn is joining me. The Smart Mouth Smart Kids Toolkit was developed with the support of the DentaQuest Foundation, and the idea was to develop something that would allow any community or any school or individual to begin a sustainable in-school oral health program. The objectives today for our presentation are to have you be aware of the Smart Mouth Smart Kids Toolkit and to be able to support the initiation or refinement of school-based oral health programs, and then to also understand that the Smart Mouth Smart Kids Toolkit is one of many tools in the resource library that can help support the oral health community. As we began to develop our toolkit, our vision of impact was that communities would have the tools to ensure that elementary and middle school age children have access to preventive oral care and a dental home, which we thought was a critical piece of providing good care. Who's it for? As we were talking, anybody can be a part of the process. It's more than just a Sealant program. It's really looking at the whole child, the whole community, and the whole school, as that is a part of it. It's a process that anybody can be involved in and anybody can begin to utilize to get a good preventive oral health program into its school system. It's to help communities who may not have begun to have that process to achieve the health equity that all children deserve throughout the state. Again, it's more than just sealants. Equity is at the center of everything that we do, knowing that we have great disparities in the state of Colorado, and I think that is reflected in other states also. We want to have programs that are integrated with behavioral health and primary care in order to assure student success. We want to align all of the partners and stakeholders that may be in a community or throughout the state to provide quality care. And then we want to have a program that will be sustainable, or as we're saying now, that will be thrivable, that will grow, that will be dynamic, and that will contribute to the ongoing health care of the children in the programs. It needs to be something that works for you and your community. And so everybody is going to do something just a little bit different with this toolkit. It is customizable. You can start a program with it. I think one of the most exciting things is if you have an established program, you can use it to begin to refine what you have. And you can deal with a whole menu of services, sealants screenings and prophies. Actually, you can have a program that also has treatment and certainly education for the children, the parents, and the schools and members of school staff that are taking part in the program. It does provide much needed tools for a needs assessment, stakeholder engagement, public will building, developing a budget, and doing a basic business plan.
Hi everybody, this is Grace, and I'm going to talk a little bit about what the toolkit is, and it is a website. You can go to smartmouthssmartkids.org, and you see a screen capture here of the home page. To build on a little bit of what Karen was saying, we used, you see the treehouse being built, we kind of used a building metaphor for the site because we wanted the tools here to be available to, a program, whether they're just in the idea generation stage, whether they're structurally laying more of a foundation, maybe they're framing and building a little further along the road. And then always important is thinking ahead to maintaining and sustaining what you're building. So take a peek after today, not right now, and see what's there, because we think there's something there for lots of different programs along that continuum. I am going to talk briefly about two of the popular tools that you will find in the toolkit. One is this feasibility calculator, which is basically an Excel spreadsheet on steroids, we like to refer to it, and it gives programs a chance to play with numbers. You can use these different forms, a program or school entry form, a program entry form, staff time estimates, and you can plug in different numbers and see, will your program be sustainable and feasible given what your projections are? And it can also be used by programs that are already, providing different in-school oral health services. If they're thinking about expanding or changing, some pieces parts of their program. So the feasibility calculator has been a very popular tool. The other one is our data collection tool, which really functions as a limited but focused electronic dental record. And it's designed to capture data elements most commonly needed in a school setting. So here in Colorado, we realized, we had trouble sometimes following kids in the school system. And so a big piece of the reason we built this tool was so that we could start to follow kids longitudinally, even if they move schools in the state. So we partnered with our Department of Education and our Department of Public Health. And it's a really great tool, and we can assist you in doing a demo with it or looking at opportunities for different states as well to implement this tool. So some steps you can take, of course, go visit that toolkit. Pick the spot in your construction that you'd like to plan, build, or refresh. Explore the tools that are there to support your work. We are promoting our social media channels, so it would be great if you would follow us on Facebook and Twitter. And you might want to think about joining the National Movement for Oral Health by visiting www.oralhealth.network.
And I think that's it. Thank you.
Thank you, Grace and Karen, and such a important plug for the Oral Health Network, where you can connect with others who are in the oral health network and space who are working towards some of the same goals. So we have similar tools from the state and local level that are also in the resource library. For example, we have sample consent forms from some of our learning collaborative members. So they try out different things, and they have different resources that have worked for them that may work for you and your team. We also have resources who are from reputable organizations and databases. One example of a well-known resource that you may have seen come across your email waves is from the National Maternal and Child Oral Health Resource Center. So I will pass it on to Katrina Holt, who will say more about this.
Hello, this is Katrina Holt, and as mentioned, I'm from the National Maternal and Child Oral Health Resource Center, or commonly referred to it as OHRC for short. As many of you know, the Resource Center is funded by the Federal Maternal and Child Health Bureau, and our charge is to support professionals working to improve the oral health of pregnant women, children, adolescents, and their families. To achieve this, we work closely with many national professional organizations, and one very important one is the School-Based Health Alliance. In addition to the many wonderful materials that are featured on the new School Oral Health Resource Library, there are other resources on the OHRC website that you may find useful. And I'd like to give you a short tour of our site. You can find the website at the URL www.mchoralhealth.org. Our homepage offers several tools and shortcuts to help you find many useful resources. I'll show you how to use some of these in this presentation. Let's begin with the left navigation bar. These items form an index to everything that is on our site. When you click on the orange titles, they expand to show you more titles. For example, if you click on publications, you can view the Resource Center publications by category or by title. The Publications by Title page shows you our resources for consumers and also for professionals. As you scroll down this page, you'll find numerous materials including brochures, curricula, fact sheets, guides, manuals, and much more. Publications by dates shows you our recent publications at the top and goes back in time as you scroll down the page. This is a great way to browse our work over the years, going from 2017 all the way back to 1998. Let's go back to the home page, and looking at the left navigation bar, you can see that some titles have more subtitles than others. I'm looking under the category that says topics. And if you're looking at the actual site, you would see 19 different topics. And they range from issues focusing on dental sealants, fluoride varnish, K through 12 education, and tobacco. I'd like for us just to look at one. And I'm going to click on the one that says School Oral Health Services. And when you get to this page, you're seeing at the very top, let's see, I am unable to control the screen. There we go. Now we're back on the page. So we're looking at the very top. And here you see there's about a dozen statements, and we call these key facts. And this is information that's pulled from the professional literature. These statements can be inserted into a grant proposal or into a publication, or used as talking points to communicate key facts to others. I'm going to have you advance to my next slide. Thank you so much. So further down this page, you'll find references for those key facts we just looked at. And these are followed by a list of materials that have been produced by the Resource Center on this topic. On the next slide, you'll see, this is moving down the page, you'll see a list of materials on this particular, and this one again is focusing on school oral health services. And if you don't find what you're looking for, or if you'd like personal assistance, there's a link to contact the Resource Center for help. And you see it's at the very bottom of the page. Okay. All right, and now we're on the next page. And I want you to look into the middle of the screen, and you can see there's a few items that are listed. These things that are new or particular interest. So there's 4 items that are listed. I just want to call out one, which is the Oral Health Resource Bulletin. This is a publication produced by the Resource Center that we do twice a year, and it describes recently produced materials. So it's a great way to see what things have recently been produced by many different federal agencies and organizations. Now we're going to look at the right side of the screen, and you see there is an array of colorful boxes. These are links to some of our most popular resources, such as the Integration Framework, the Bright Futures Pocket Guide, Consumer Materials, and the Seal America Manual. What's nice about these links is that they go directly to the resource. So if you click on the box, in one click, you'll get to the resource. I'd like to highlight just 2 of these featured resources. The first one you see here is Integrating Sustainable Oral Health Services into Primary Care and School-Based Health Centers, a framework. This resource describes 6 levels of integration to help centers evaluate their current level of integration. It also includes key elements to help them more fully integrate oral health into primary care, into school-based health services. The information for this framework is based on experience of 11 projects that were funded by the Maternal and Child Health Bureau. They all focused on this goal of integrating oral health services into primary care. Once the project ended, we summarized their findings and lessons learned to produce this framework. And we'd like to thank our colleagues at the School-Based Health Alliance for serving on the advisory committee and helping us with this important work. The second popular resource to highlight is the Bright Futures Oral Health Pocket Guide. This guide provides health professionals with an overview of oral health supervision for 5 periods. And you see them on the left side of the screen. They are during pregnancy and postpartum, infancy, during early childhood, middle childhood, and adolescence. For each of these 5 periods, the guide shares information about family preparation, risk assessment and screening, and it also includes information on examination, preventive procedures, and anticipatory guidance. You can access the Pocket Guide in a variety of formats. So as you can see, it's here online and also available as a downloadable PDF file and in print. At the bottom of the page, you see that there is a link, and this is where you can order free copies of the Pocket Guide for yourself and other professionals. This is our online order form, and if you fill this information out, in 2 weeks, we will be shipping Pocket Guides to your door. Going back to the home page, you also see at the bottom, there's an easy way to access materials that were just recently added to the OHRC library. Here you see the 2 that are featured, and continue to view this page, because as we continue to add materials to the collection, they're immediately added to our website. And then on the lower right-hand side, we offer you 2 search tools. One is that you can search the library, which currently contains over 3,000 materials. And then you also can search the entire website. The last resource I want to mention is important communication tools, including announcement and discussion lists and newsletter, to help keep in touch. Under newsletters, you can select announcements to access the Resource Center's monthly electronic newsletter. OHRC announcement. This is our vehicle to share information with you about new resources, website features, and other resources focusing on oral health. On this page, you see there's the green button and allows you to subscribe to the newsletter, and you can also view all past issues online. So I hope this tour of the Resource Center website has been helpful, and you're looking forward to exploring it further. I encourage you to visit the site often. We're constantly adding new resources, and please don't hesitate to contact the Resource Center if you'd like assistance. Thank you so much.
Thank you, Katrina, for that comprehensive look into the OHRC's database. We definitely will make sure that we take a look at it, and also some of the resources that are in our resource library directly links over to OHRC's. So we're very glad to have that capability in there. Finally, there's one last source from where we hope to get resources, and that's you. This resource library was created to connect the field to resources that are tried and true, and those that are new and effective, all from you. You can submit your resources using the new resource submission form that is located in the resource library under the filtering tool, and we'll be dropping a link in the chat box very soon. You can submit resources you believe were effective in the development and enhancement of your school oral health efforts. So that can be a PDF, a Word doc, an Excel sheet of an assessment tool, a PowerPoint presentation, or video series that you thought were helpful, or a direct link to a resource you felt helped your activity or program thrive. So right now, you can do that on the online submission form, which will be available as a permanent fixture on our site. And we are doing this because, of course, to elevate your work for those who are engaged or somehow connected to school health and school oral health. So the new resource submission form is a new process for us. So it involves some testing on our part. So we ask that if you do have a resource that you want to get in there really soon, we say go ahead by all means. So it will help us make sure our process and system works effectively for this platform. And we want to make sure we thank our partners for their input and their resources throughout the development of this resource library. So thank you to the Association of State and Territorial Dental Directors, also known as ASTDD, the Children's Dental Health Project, the National Maternal and Child Oral Health Resource Center, and Oral Health America. And of course, if you have any questions on the resource library, please feel free to contact me. And if you have any more questions for Smart Mouth, Smart Kids, please feel free to contact Karen. And for the National Maternal and Child Oral Health Research Center, please contact Katrina at the emails listed on the screen. So now we'll turn it back over for questions.
So yes, now is the perfect time to ask your questions. Feel free to enter your questions in the Q&A inbox of the Zoom control toolbar. So we want to give everyone an opportunity to enter the questions. So while everyone is doing that, we do have a few announcements. So let me tell you a bit about our membership. The School-Based Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based healthcare. Our members extend and support our work. Trainings like this webinar would not be possible without the support of our members. In addition, our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after the presentation to visit our website using the link on your screen for more information and to join. Our 2018 convention will take place on June 24th through the 27th in Indianapolis, Indiana. We're excited to bring back the school oral health centered workshops for a second time this year. Attendees will be able to choose from a variety of oral health workshops and posters related to the school oral health, from youth engagement to teledentistry. So please save the date and we look forward to seeing you there. All right, so we have a few questions. Let me put them up. So our first question is, what is the turnaround time when submitting resources?
So that's a really good question. So right now we are going to be reviewing them probably each week to make sure we're looking at them in its entirety and not just doing a poor job to review it. So we'll try to turn around as quickly as possible, so hopefully within the week.
Okay. So we had someone ask if this presentation would be available to, after today. Yes, this webinar is actually being recorded and it will be on our website within 3 to 5 business days.
And someone did ask what type of resources we're looking for. So again, we're looking for resources that you feel were helpful in enhancing your activities, school oral health activities or programs. So we're not turning away any resources that you may have. That is not something we have set in our perimeters to do. So please feel free to forward us or send us any resources that you definitely felt was helpful, even if in the minimal, most basic way it's possible. So please send us those resources.
Okay. We have another question. Do you have resources for parents?
Yes, we do. We definitely have resources for parents. We have, for one example, we have a resource, a little resource sheet of books parents can read to their children who are in their primary care age, so probably 0 to 5. So we have some other resources also that explain what sealants are and what fluoride varnish are and what's happening when the dentists come visit the school. So we definitely have resources in the research library for parents and also youth who want to take control of their own health.
Okay, we have another question. Do you have a list of states which permit RNs in schools to apply FV with a blanket order, not a patient-specific order?
So that is a question to apply fluoride varnish. We definitely have to look at it, but we have some, based off of my memory, which is probably a little shot right now, but we do have some resources that specify the parameters for nurses and dental hygienists to practice. So that would definitely get back to you, Erin Harnett, on that.
Okay. Okay, we have another question. So I think this is in relation to the previous question, but will this be permanently on the website?
Yes, of course. This is a permanent fixture on the website, so it will not be going anywhere in my lifetime, which hopefully I have enough left.
Okay, let's see if we have any more questions. So it looks like right now we don't have any more questions, but I do have, for our attendees, we have a few questions for you. After we do these questions, or the poll questions, we'll definitely go back to any questions that we see in the Q&A toolbox. We want to give you guys a few more minutes to finish answering our poll questions, and then we'll go back to all of the questions in our Q&A box. Okay, so we do have some questions. We're going to take a few more questions before we all log out. Okay, so can parent resource books be sent to organizations to hand out to parents? I believe Donna might have answered this question in our chat box.
So, the books that I was talking about earlier, we do not actually send them out. So this is more of a resource, a list of books that are available on oral health that not necessarily we have on hand or in our inventory for to be sent out. But I can forward you that list if you would like to leave your, just directly, privately chat us your email address, and we'll send that to you directly. And
right, what is the website address? It was blocked on my screen. Okay.
So we would definitely share out the link to the website after this call, so everyone will have it on file. And also you can go visit us at sbhforall.org, and it will be right under the resources tab.
All right, answered all those questions. Okay.
Oh, sorry. So, I think if there's no more questions, we will definitely send all those resources out to everyone. And thank you all for gathering today and joining us. And we hope you have a great weekend.
All right. So thank you all for attending our webinar today, and our serious thank you to all of our presenters. So if you guys have any additional questions pertaining to the school oral health resource library, please feel free to contact Nataki Duncan or Tammy Alexander. We'll make sure to send out an email with their email addresses for you. And for questions about the School-Based Health Alliance, please email info@sph4all.org. Thank you.